Treatment for lung cancer is based on the type of lung cancer, whether it's small cell or non-small cell. And then within non-small cell, there are different types: adenocarcinoma, squamous cell carcinoma, neuroendocrine tumors. And then, as you may know, each one then gets subdivided depending on the protein that's overexpressed on it, or if there's certain genetic mutations that we find on it. So the treatment is based on the type of lung cancer, its genetic fingerprint, but also on the stage of the lung cancer. Lung cancer, just like any other cancer, is divided into 4 stages. Stage 1 being the earliest, stage 4 being the most advanced. Stage 1 lung cancer is when the cancer is quite small, and it's only in the lung. It has not traveled to the lymph nodes, and it has not traveled to any other organs. The best treatment for stage 1 lung cancer is to remove it with surgery. We no longer have these days to do a big incision. We can do it with little incisions, a 3D camera, and long, thin instruments called robotic surgery. We used to have to remove the whole lung, or a whole lobe, or a third of the lung. But that's no longer the case. If we're able to catch the cancer when it's still quite small, stage 1, we can now remove only a segment of lung, a smaller anatomic portion of the lung, which allows the patients to have a better quality of life, leaves them with more lung capacity so that they can breathe better. For patients who cannot tolerate having surgery for their stage 1 lung cancer, or who simply don't want surgery, the alternative to surgery, albeit with a slightly lower success rate, is radiation, what we call SBRT, or stereotactic body radiation, which is high-dose pinpoint radiation over 3 to 5 days, targeted specifically to the cancer. And that is a good alternative to surgery for patients who are too old, too sick, or simply don't want surgery. The results are very good, not as good as surgery.